Dr. Celine Gounder is a CBS News medical contributor and editor-at-large for public health at KFF. Good morning. How are you doing?
I'm good. Thank you, Nate.
Thank you for joining us. So how does a seemingly healthy 18-year-old go into cardiac arrest?
Well, there are a couple different scenarios that could have played out here. One is what we call hypertrophic cardiomyopathy, which is basically a thickening of the heart muscle. We see this often in elite athletes, as well as sometimes with certain genetic predispositions. Second scenario is what happened to Damar Hamlin, what we call commotio cordis, where somebody sustains a hit to the chest. It's timed perfectly during the cardiac rhythm that it sends you into cardiac arrest. And the third possibility is a genetic arrhythmia, so abnormal heart rhythm.
You know, people were asking me because I'm the former athlete in my friend's circle, and I didn't have an answer to the question, how often does this happen? For some reason, I feel like it does happen more often than we actually think. So could you answer that for me?
Yeah, it happens more often than we actually realize, and it really hits the headlines when it's somebody famous, like Damar Hamlin, like Bronny James. But this is certainly something that happens. And I think a key question also, this has been studied by researchers at the University of Washington. They've looked at all NCAA athletes, how often you see sudden cardiac arrest. And the group that is at highest risk are black male college basketball players. And why black men? Why basketball? That we don't have a good answer to, and that really needs to be studied more closely.
I know Keontae Johnson in college basketball, Jared Butler, a couple others where we've seen something similar with them. It's great news that he is out of intensive care right now. As far as regular health and then also basketball future, what are doctors going to look for now in the coming days with Bronny?
Well, in general, and I can't speak specifically to Bronny's case, these kinds of elite athletes will have some sort of cardiac screening. So that would include, at baseline, so an EKG, an echocardiogram. So he probably had those, which means he probably does not have hypertrophic cardiomyopathy. That would have been picked up on an echocardiogram. So setting that aside, could he have had commotio cordis like Damar Hamlin? We don't know that he sustained a hit to the chest. So that leaves a genetic arrhythmia. So the next step in the workup would be an MRI of the heart to look more closely at the heart muscle, putting him on a monitor to see if he has arrhythmias again, and perhaps some genetic testing. So all of that, you're talking about probably a couple months at least of testing, follow-up, trying to assess, does he have a recurrence before easing back into training and play.
Dr. Gounder, this happens in a context. We've had a big debate about COVID-19 and the result, what happens when you have vaccines. And anytime somebody famous has a heart event, as you know, it gets sorted into this, it's a reaction to the vaccine. What's your response to that kind of thinking?
So I want to be very clear. This has nothing to do with COVID-19 vaccines. Over 80% of the American population has now had a COVID vaccination, if not more than one. That would be like saying, I need my tooth pulled out next week. That must be because I had COVID vaccination. These are unrelated events, but this is straight out of the anti-vax playbook to say, well, just asking questions, maybe, how do you know? And I think what's the intent here is to sow confusion, to make people wonder, and it's having that impact.
Yes, indeed. Dr. Gounder, thank you so much for being here, as always.